The crooked teeth are very hard to clean and very prone to other dental ailments like decay or gum disease. So, it is also very important that in addition to the cause for appearance, the crooked teeth should be treated by an orthodontist, because there could be many associated other dental problems which could be prevented. What happens? How does the braces bring about management of crooked or irregular teeth? Usually the braces and the bands and wires, they apply force or pressure on the teeth and slowly move these teeth to the desired position. So, when the force is applied, the direction where the teeth are to be moved, the bone is resorbed, and on the opposite side the bone gets deposited, and this is how a slow forces over a long period of time will bring about their movement. And once the active phase of the treatment is over, the patient is required to wear retainers, because what happens if those teeth are not retained at that position, and then what happens, the teeth can go back, there is a memory, and the teeth can go back to the position from where they were moved. Also, many a times when the space is not there, few teeth have to be extracted to create space. This is another area where patients must know that some of the patients are not very keen, or they are very reluctant to get the natural teeth extracted, because if the teeth have to be moved to the desired position, you need space, and if space is not there, space is to be created. But usually these teeth are extracted from in such a way that so that it does not impact the harmony of the remaining teeth. So, usually 4 teeth are extracted, or sometimes less than that also, depending on a situation. And after the active phase of the treatment is over, the patient is made to wear retainers for fairly long time, a couple of months, so that these teeth are retained at the desired position. Before the treatment is started, the specialist will ensure that there is no active disease in the patient's mouth. The patient does not have any gum disease, patient does not have any dental decay, or patient's hygiene is okay, patient has to undergo scaling. So, all this, it has to be in a fairly good state of health, so that it does not impact or impede the orthodontic treatment. During the treatment also, patient is instructed to maintain hygiene. Patient is also instructed not to use very sticky, hard, or some kind of a food which can actually can impact the bands, or the orthodontic wires, or so called braces. So, patient is instructed, and if there is any mishap, if there is any if there anything, it should be, the patient must report to the specialist or to the treating orthodontist immediately, and not indulge in doing doing anything oneself. Also, what is the right age of braces? This is a question which usually posed by patients. Yes, braces are done applied for permanent teeth. So, usually in the adolescent, when most of the permanent teeth have come, but many a times there is a preventive orthodontics, where children of a young age are taken under the fold of an orthodontist, the care of an orthodontist, so that they envisage, or they predict that this particular child is heading for irregular teeth or crooked teeth, and they do some interception or prevention, so that the treatment can be either prevented or minimized. And they also ensure that by doing all that, a very extensive kind of a treatment is not provided to the patient when the child grows up. So, there is an element of prevention also. So, only a specialist orthodontist can assess and gauge whether this patient would be required preventive orthodontics. So, again the moral of the story is that we must consult a specialist, orthodontist, if there is any issue, and your doctor would be the best person to guide you, to counsel you what is best in your interest.